Assalamu alaikum and welcome to Perspective. We'll be talking about the COVID-19 situation across the country. Of course, the NCOC is now considering a major lockdown in the major cities, barring what is happening around Pakistan, and also the Prime Minister has called in the army to assist as far as the situation is concerned. As of today, we don't know what will happen in the next couple of weeks. What are some of the precautions that we need to take as of immediately? We'll be talking about that. We'll also be talking about the prevalent situation as far as oxygen is concerned, as far as hospitals are concerned. What are some of the steps that we can take collectively as a society? Of course, follow the SOPs. But other than that, all of that today on Perspective. I have with me Javed Sadiq, who's a senior journalist. Thank you for joining us today. Professor Dr. Atar Rahman, Chairman PM Task Force on Science and Technology. Thank you for being with us today. And Mufti Imran Sandhu, who is a religious scholar. Thank you for joining us today. Javed sir, like I said, the situation clearly is much worse than what was a couple of weeks ago. Things seem to have escalated. We've seen what's happening across the border also. Of course, I think this is the right time to say that whatever political affiliations anyone has, this is above politics, this is about humanity and Pakistan. Prime Minister also has said that we stand with India in this time of crisis. But what about the situation in Pakistan at this time? How do you see things developing?
Well, unfortunately, the third wave has proven to be very scary and is actually doing a lot of damage to the people. Infection rate has grown and it is more than 10% in many cities of Pakistan, which is very alarming. And it is a signal that the nation needs to prepare itself to face this third wave of coronavirus, which seems to be very serious. Pakistanis, they have taken this disease from the very beginning very lightly and very flippantly. Unfortunately, we are still seeing the scenes in the markets in many places where people are not following the SOPs. They are not wearing masks. They are not maintaining the social distance, which they must. And also I've seen that in the mosques, where the ulamas and the imams are supposed to tell their namazis or the people who are praying in the mosque to maintain a social distance and wear masks, and nobody is doing it. Similarly, in other crowded places, eating places and open eating places, people are not adhering to these SOPs, which is a must. And I think one of the reasons why we must abide by the SOPs set up by the government, that we do not have enough resources to cure those people who are infected by COVID-19. Even the Western countries, the rich countries, have not been able to cope with the situation because despite the fact that they have huge resources at their command. So we need to be very careful. We need to, I think, strictly abide by the SOPs.
The Prime Minister has asked the army to assist in ensuring that the SOPs are followed. Why do you think that there was need for that to happen? Of course, like you just said, that people are not following the SOPs, but shouldn't our civilian administration have been enough to enforce the SOPs at this time?
What we have witnessed in the past few months, that the civilian administration has not been able to effectively enforce the SOPs, and probably the people are taking them very lightly, and also they are not very effectively doing it. So I think the presence of army will make a big difference. And I think in the first phase, 2 years back, when the coronavirus started spreading in Pakistan and people were infected, the presence of Rangers or army made a difference. I think it has a deterring effect on the people at large. So that is, I think, the reason the army has been called to assist the civilian administration to make the people abide by the SOPs. And I think that can make a difference.
So, what do you think it says about our society? Because, on the one hand, we are seeing such a huge number of people getting affected every day. We're also seeing number of deaths increasing. But again, like you said, there are people who are simply not following the.
I think this is a societal attitude, and that's not fair. In fact, there are conspiracy theories taking ground that corona doesn't exist. It is an international theory.
Even after a year of battling the COVID-19, we are still there where we are having these, issues like conspiracy theories when most of the world has been seen to suffer so much.
Almost 3 million people have died of this infections. But unfortunately, people are taking it very lightly here. You go to the urban areas and in the rural areas, people just do not think that this disease or this virus exists, or people are being affected or infected by it. So I think we need to be very serious. Our leaders, particularly the religious leaders and the other societal leaders, they must play their role in convincing the people, yes, this is a very serious disease and we are being affected, and because of paucity of resources, Pakistan will be in a severe crisis.
Let's go to Professor Dr. Rahman. I'll come back to you. Professor Saab, what do you feel about the situation at this time? Of course, you are in a position to know exactly what the situation is as far as hospitals are concerned, as far as, overall the situation is concerned at this time. Can you tell us a little bit about that?
Bismillahirrahmanirrahim. Actually, what is happening is that the virus is constantly mutating. And at the Karachi University, in the Jamil Rahman Center for Genomics Research, we've been following very closely how the virus is changing its structure. And it's very dangerous what's going on. Every 1 or 2 weeks, the new mutations are being discovered. We have discovered about 140 mutations. Some of them are in critically important areas. And so the efficacy of the vaccines then becomes questionable. If you have the virus mutating at critically important points, then the efficacy goes down. And now with that, with the import of the B117 variety from the United Kingdom, and with the 2 mutations that have developed in India, and the 3rd mutation which has been found in Bengal, it becomes extremely important for us to try to seal our borders as far as possible, to protect us from these new mutants, which are much more, which spread much more easily, which are much higher mortality, and which are a cause of deep concern. And you see, things in India have spun out of control. They claim there are about 350,000 or so people affected daily, but in fact it could be nearer a million, because these are only the reported cases that you are hearing about. And there are more than 2,000 deaths occurring every day. So things are really out of control because of the poor management of the Indian government of this situation. Till a few days ago, they were holding these large congregations, and this has also contributed to this. In Pakistan, we have to be extremely careful that we don't go down the same path.
Also, do you think perhaps, of course, as the Prime Minister has said again and again, that we have to keep in mind our own economic situation also, and of course the last wave and the way that Pakistan dealt with that, but do you think that perhaps, like you said, that the virus is constantly mutating, so perhaps our way of dealing with it is perhaps not as aggressive as it should be? Perhaps we should move for a stricter lockdown at this time, and the way things happened last time is perhaps not the way to go about it during this wave. Do you agree with that?
No, I don't agree with that, because I think the National Command and Control Center has got all the data with it, and they're monitoring the whole situation on an hour-by-hour basis, and they are locking down areas which are affected. And this strategy has worked extremely well. You can compare us with Europe or USA, which have much better health systems, but Pakistan has done outstandingly well by comparison. So I think what NCOC is doing is absolutely right. If there is a need for
even with this at this time, what's happening with the virus and the fact that, like you are saying, it's constantly mutating, how effective is the vaccine at this time?
The vaccines are pretty broad spectrum, and they are going to be protecting you against serious illness. They will not be able to protect you from coronavirus attacking you, but it would usually be mild attacks. But they are all the vaccines that have been tried. They are all pretty good, and they are preventive of serious illness, and also the mortality is reduced as a result of that. So I think there's not such a big problem as yet, but there could be a problem in the future. And so I think the strategy that Pakistan has adopted so far has been very good. If you completely lock down, then people will start dying of hunger, not of COVID, but of hunger, and that's something you can't afford. So the situation is between a rock and a hard place. It's a tough decision. And so I think when it comes to making that decision, the government will make that decision. But it is already locking down various areas of the country. And so it is, so far the strategy has been effective. I can only hope that it will continue to be as effective as it has been in the past.
Professor Dr. Ataur Rahman, please stay with us. I'm just going to go to Mufti Imran Sandhu Sabji. Imran sir, there is a lot that is said about, of course, it's the month of Ramadan and the way that things, of course, the mosque and the way that the religious scholars are their duty, of course, at this time is to tell people about how to manage themselves, to follow the SOPs. Do you think that is being done, efficiently?
Bismillah ar-Rahman ar-Rahim. At the national level, I believe it is not being done as it should be done, even by the imams at the moment. Let's not be it's very obvious that last time there was a consultation going on with the ulama and everything, and the SOPs were made. But now this year, I think we have taken this for granted. Last year we were not hit as badly as we are being hit at this point. My mother passed away 2 days ago with the same. So I'm personally I'm very sad at the moment to say that we must be very, very careful. I was trying to protect my mother, but with all the SOPs, she got contacted the coronavirus. But it doesn't mean that we should not be following SOPs. SOPs do, if we follow them, we are not careless with them. They will protect us. And there's a Sharia guideline on that as well. Sharia has given complete guideline to humanity when a pandemic or an epidemic comes in. What should be our behavior? For example, I would say the face masking. This is the key to the first SOP. The key to become safe from coronavirus. The face masking. And there's a hadith says in the Nabi sallallahu alayhi wa sallam, kana idha atasa waqta wajhahu biyadihi aw bi thawbihi aw ghadda biha sawtahu. While sneezing, Rasulullah sallallahu alayhi wa sallam would cover his face with his hands or with a garment. So this is one of the Sharia guidelines that we should follow. The Sharia gives an ishara. It points out to this kind of attitude that do not let your sneezing even affect the people. Then another thing that Sharia tells about social distancing. Rasulullah said, "La adwa wa la tayrata wa la hamata wa la safara wa firra min al-mazlumi kama tafirru min al-asad." Run away from a leper. That is one of the contagious diseases, ailments of like everybody knows, as you run away from a lion. So, Sharia guidelines tell that do not try to be overconfident when a pandemic is going. Run away from the place where you think that you can get infected from a disease like this, from a pandemic like this. Then Sharia also gives a guideline on travel ban. Traveling, do not travel from a place like it is said, وَإِذَا سَمِعْتُمْ بِالْأَرْضِ فَلَا تَدْخُلُوا عَلَيْهِ وَإِذَا دَخَلَهَا عَلَيْكُمْ فَلَا تَخْرُجُوهَا مِنْهَا فِرَارًا. Do not enter a land where the plague or contagious ailment is broken out, and do not leave from where it is has broken out. Rather, one of the guidance says that if you leave, do not go to a place where, like, quarantine yourself at a third place. And then there's another hadith that tells about la yuridu mumridun ala muslim, like those who are with contagious disease should be kept away from those who are healthy. So Sharia is very clear. The Sharia guidelines are clear that the humanity must take care of humanity. We should not encourage the SOPs and discourage people who are not following SOPs.
We should have perhaps, do you think that, of course, keeping in mind the Sharia also and the situation as it stands, don't you think we should perhaps have moved towards a travel ban sooner, a stricter travel ban? Even at this time, we should perhaps move towards a more stricter travel ban?
Yes, there is a principle of Sharia that tells that we must, like, the administration, how you should administrate the matter. It's a matter of administration. When it comes to administering the pandemic season, like. They say, I'll narrate in Urdu, then I'll translate, like intizam ala wajh istemal hota hai. Like you should be thinking forward and taking all the administrative measures. So I asked my parents even, like there was a wedding ceremony that was to be conducted. I told my parents that last year, in the same month, the pandemic had gone viral. So let's move it forward in September. But unfortunately, that was not like the elders did not hear me out at the moment. So that is why I say that at the national level, we must proactively decide things. We should not decide we should not await a contingency to happen and then decide. Rather, we should be proactive. We should be thinking one step ahead in order to save our Pakistanis, our dear Pakistanis, our nation from. I don't know whether, I do not have the real picture, but I think I heard someone saying that we are already at 80% of the oxygen requirement at the moment. Only 20% stocks left over. So,
let's ask Dr. Ataur Rahman, Professor Dr. Ataur Rahman about that. Professor sir, what's our situation? Because of course everyone's getting very concerned hearing things from across the border as far as oxygen is also concerned. What's the situation in Pakistan? Can you tell us?
I think the hospital have reached 80-90% limit of the oxygen capacity, and they have only very little oxygen left. Others have a little more oxygen, so it varies from place to place. But in this situation, could very easily go out of control. And so, what needs to be done by the government is to make sure that they have probably a space for another 4 weeks before things start going out of control. So the time to order large supplies of oxygen is right now. Also ventilators, and also to arrange extra beds for emergency situations, and also medications that are required. We must take the necessary action right now, and I expect that NCOC is going about doing this because tomorrow will be too late. What Mufti Sahab was saying was absolutely right. In this situation, we have to be proactive. We have to look ahead, not wait for the situation to really spin out of control, but to act right now. And so it's not just the oxygen situation. We also have a limited number of health workers. Our health system is generally quite weak. And if a situation like India, in Mufulana Khalsa, emerges here, God forbid, then we certainly will not be able to deal with it. So we need to prepare for an emergency situation which may occur within 4 to 8 weeks right now if God forbid, this virus starts multiplying and the mutant virus starts spreading fast over here. We should also have control over travel.
Reinfections, because we've seen a lot of that happening. Earlier on there was of course this belief that once you've tested positive during the first wave, you'll be okay. But now, of course, we're seeing a lot of reinfections also. That is also because of the mutation of the virus.
No, actually, once you have been infected with the virus, then for a few months you have a certain level of antibodies, but that decreases quite fast. So after 3, 4 or 5 months, you can easily be attacked by the virus again. And the same applies if you have a vaccine. The vaccine will not give you 100% protection. It will only give you partial protection against serious illness, as I said, but it will not prevent the attack of coronavirus. And there is no other option but to take the necessary precautions, strictly follow the SOPs. There are no medicines available as yet. There is a huge...
Before I go to Javed Saab, Professor Saab, there's a lot of criticism that has recently been made on the issue of vaccination. There's a lot being said about the pace of it. There people are saying that it's very slow. A lot of people should have been vaccinated by now. Of course, we saw that the vaccine itself was in a lot of places was not available. Getting that to come again, all of that. Why has it happened this way?
You see, firstly, we must understand that Pakistan does not make these vaccines. In contrast to India, which has 2 large companies manufacturing corona vaccines and also supplying to the world. And yet the situation in India is much worse than it is in Pakistan. Secondly, what the European countries and what countries like Canada have done is to order large supplies of vaccines, which is 3 to 5 times larger than their population size, and they have paid them in advance. So most of these countries are committed to supplying vaccines to Canada and to other European countries, and so this supply is limited, and so we have not therefore been able to get sufficient supply of vaccines. I think we have got about 1.2 million or so doses which have come into, and another 1 million or 2 million are on their way. But when you're looking at the size of the country of 220 million, and you want about 60% vaccinated, which is 150 million, it is not even 1 or 2% of the population that we've been able to vaccinate so far. So you are far behind the target. And unless you vaccinate about 60 or 70% of your population, you're not going to get herd immunity and you won't have enough protection. And that is at least 12 to 18 months down the road before we have that kind of numbers being vaccinated. So at the moment, you have no option but to follow the SOPs. There is some light at the end of the tunnel. There's one medicine which is found to be quite good in phase 2 clinical trials. It's called mahrukh, and this is being used in SARS and MERS, and it's been found that it drops the level of viruses quite sharply. And this is a medicine made by Merck in USA. And phase 2 clinical trial which is completed and phase 3 is underway. So there is one bit of light at the end of the tunnel, as I said. Some nasal vaccines have also been developed now, so that you don't have to get a jab.
How long do you expect this medicine to be available in the market?
If it passes the phase 3 clinical trials, which should happen in about 4 months, and if the FDA approves it and WHO approves it, then it should be 6 to 8 months down the road, this medicine will become available.
So either way, even in the best case scenario, we're looking at least a year.
Exactly. There's nothing at the moment available except to take the necessary precautions, and for the government to make sure that hospitals are properly equipped and there are emergency arrangements in case the hospital beds are not enough. Then there are some field hospitals. Every hospital, I think, should have possibilities of a field hospital in case there is an overflow situation. and should have sufficient supply of oxygen as well as ventilators and other things. Ventilator manufacture has begun in Pakistan. These are Turkish ventilators which are being assembled here, but we are not making our own ventilators as yet.
Right. Let me come back to you. I'm going to go to Javed Siddique Sabji. Javed Sab, you've been listening to our discussion. How do you see things as far as, of course, on the one hand, we have the issue of 80-90% oxygen depletion at this time, and on the other hand, of course, we are looking at stricter measures from the NCOC. But do you think perhaps, we keep on talking about lockdown, and we keep on talking about the fact that, that is perhaps our last option. But when do you think we'll get to the point where we'll feel, because of course, everyone is really, really scared after what's happening in India.
Well, I think the NCOC has warned the people of the severity of the crisis, and the virus is affecting people increasingly. So the NCOC is well aware of it. They have made the people aware of it. I think they have also apprised the business community, the leaders of the business community, to prepare itself mentally for a lockdown. But I have seen a lot of resistance from the business community, from the traders, and they are saying that this lockdown will have a very negative impact on the business community. So they are resisting it. It is very unfortunate. I think they should cooperate with the government. It's not the cooperation with the government. It is, in fact, saving the lives of your own people.
Right.
When you are infected and when you contract this coronavirus, it is very dangerous. The entire family could get affected. So hundreds of thousands of people, a country with a population of 200 million plus, can be a very dangerous situation.
But don't you think, we saw from across the border also the Kumbh Ka Mela also happening,
yes.
A lot of their own festivals are happening. And the result of that we've seen now.
Yeah, so we have to, learn a lot from India, because we have seen that religious congregations and religious festivals, they have actually been the main cause of the spread of coronavirus in India, which is very alarming, and the whole world is alarmed by what's happening in India.
Exactly.
So we must learn from Indian experience. So I think we should be very careful, and I think the business community, the religious people, the teachers, and particularly the schools operating in the private sector must cooperate with the NCOC and the decision makers to protect our society from the virus.
We're also going ahead with exams.
Exactly. So I think instead of taking a confrontational approach towards NCOC and the government, we must have a cooperative attitude, and I think we should adopt all those measures which can minimize the likelihood of the spread of this coronavirus. Pakistan is already, suffering from the paucity of vaccines. Pakistan doesn't have ample resources to buy vaccines from abroad. And I think even at the global level, a huge debate is going on that the rich people, the rich countries are in a position to buy the bulk of the vaccine which is being produced anywhere in the world. And the poor countries with poor resources and shortage of resources are unable to get vaccine for their people. So that imbalance is already there. So we must also keep in mind that the vaccine is not going to be available in a big quantity in Pakistan if a large number of people are infected by this coronavirus. So all these things we must keep in our mind, and I think the best way out is to abide by the SOPs, the standard operation procedures, and I think we must protect ourselves, our people, our families, our dear ones from this virus, and for that we need to cooperate with the NCOC, with the administration, and I think whatever is being told to the people at large to protect themselves against this virus, they should abide by it, they should take it very seriously, and they should not buy these conspiracy theories as people are saying that no, there is no virus at all. We are seeing our dear ones dying of virus. We are actually attending the funerals of those people who are dying of coronavirus, and still we are taking it very lightly. I think this is the main cause that Pakistan is being affected by it. And I think we need to take a very serious view of all this.
Right, Mufti Imran Sahab, how do you see the situation as far as mosques are concerned? Do you think that, as in Ramzan, are SOPs being followed in mosques? Are people, are ulama, like I earlier said, are they educating people about the SOPs? Are people still, large quantities of people going to mosques? What kind of a reaction do you see in people?
Yes. As far as my observation is concerned, there is no following of SOP in mosques. Most of them, I would not say that all of the mosques, but most of the mosques, there was no following of SOPs in the schools, the private sector. There was no following of the SOPs in the market. And this exponential increase that we are seeing with this virus, it will go into an expansive level of infection. It will not come on unless or until there is a coherent, coordinated effort between the government and the public. So I would take this opportunity to request Dr. Saab as well. I know he listens. He has got good ears for us. That let's try to also, like schools are the place where the virus goes very quickly by, because small children do not take care of SOPs as so schools we must try to find out another way to teach in these pandemic days till the SOPs, the medical SOPs and the core SOPs are confirmed and tried and tested. Till this time, we should try to take the education on the cloud. By what I mean is try to take everything on the internet. The learning process should go to the internet. Similarly, if there should be a mechanism to check and balance, to audit which mosque, which masjid is following the SOP and who is following the SOP. There should be a counter for that as well. And new legislation should come through. In Saudi Arab, they have done excellent legislation. They are following SOPs in Makkah and Medina. We are, no matter what anybody says, but we should also try to follow those SOPs that in the mosque, those are being followed in Makkah and Medina. So let's get our heads together. Let's put our heads together. Let's put our emotions together. Let's work as a nation, not as individuals.
Right, I think that's a very good attitude. Professor Dr. Tauraman, do you know of any direction that's been given to mosques? Do you know of any measures that are being taken as far as enforcement of SOPs? Of course, Army has now been called to assist in following SOPs. But can you tell us a little bit about any of the measures that have been announced to ensure that those SOPs, like Mufti Saab is saying, there is a lack of people following SOPs in mosques, and of course with Tarawih prayers going on at this time in Ramzan, it's very essential to have those SOPs in place.
Yes, you are absolutely right. It was last year that the SOPs were decided upon. There was discussion with ulama, and there was a consensus was reached, and everybody agreed to follow those SOPs. But the problem is in the actual implementation. The imams in most places are not implementing those SOPs, and so the only option available is for the government to temporarily close down those mosques that do not follow SOPs. Because this is the life of a human being is not allowed by our religion. And no justification that we have to offer tarawih or prayers. There is no justification for risking lives of a human being. That is what our religion teaches us. That is what our Prophet Muhammad, peace be upon him, teaches us. The most precious thing for us is the life of a human being. And so we have to take whatever strict steps are needed. If the imams do not follow the SOPs, they should close down those mosques. They should announce this, that they will be surveying all the mosques, and they should then ask the citizens that if you find that any mosque is not following the SOP, please report it to this website or to this complaint, and they should then immediately act to close down those mosques. Unless this action is taken, this virus will continue to spread and will continue to take lives. And it is our joint responsibility to be able to prevent this from happening. I think we should, a contrast comes in when you look at India versus Israel. Israel today, 2 days ago, 100% of its population was vaccinated. All the people above 18 years of age have been vaccinated in Israel. They have opened up all schools, colleges and universities. They have removed the need for having masks except in certain places. And so Israel has completely opened up. China has completely opened up in most places as well. Whereas we in the West are not following certain guidelines, and what Israel did was that they ordered the doses with the Moderna and with Pfizer at much higher prices than the market rates, $15 per dose higher. So they paid $30 per dose. And when the Prime Minister of Israel was asked, why are you doing this? He said, this is a very small fraction of the cost that we have to bear if we have to close down our industries. Just 2 or 3 or 4 days worth of closure. So proactive thinking in this manner, looking ahead and making decisions, not trying to save pennies, but trying to save pounds, which you will lose otherwise if you don't look ahead. So I completely agree with what Mufti Sahab has said, that we have to be proactive. The time to act is now. We should not allow this to strike us first. We have to take preemptive action today to prevent a huge tragedy tomorrow.
Professor Saab, what about children? We've seen that this mutation of, this kind of the virus which has mutated at this time has been affecting children also. Children less than 10 years of age, a lot of children in Islamabad also are seen to be suffering. Is it because, earlier on it was said that the earlier virus wasn't affecting children so much?
Football with small protrusions on it. Those protrusions contain special proteins which are called spike proteins. And it is these protrusions emerging from this football which attack the receptors which are present in the human cell and hence enter inside the human cells. So the mutation that have occurred in the B117 mutation, which is from South Africa and went to UK and then come to us, as well as in the Indian mutation, is that the mutation have occurred in this very critical zone of these protrusions. So it will become much easier for the virus to enter into the human body, and so even a very small amount of virus, where you take all the precautions, you can still at quite significant distance, it can still attack you. And so it has become all the more necessary for us to try to be as cautious as possible, because we don't have any medicines. They are searching in the dark. They are at the moment they are looking for existing medicines which might be active, and hoping that some of them, because developing a new medicine takes 5 to 10 years and costs billions of dollars. We just don't have the time to do that. So that is why they are looking for repurposing, as they call it, existing medicines which are used against other diseases to see if they can be applied for this disease. So this is a search in the dark, and we may or may not be lucky. So at the moment, the only option available is either get yourself vaccinated if the vaccine is available, or to take due precautions, and then of course rely on Allah and pray that Allah will protect us. But we have to also take the necessary action for Allah to be able to help us.
Right, let me come back to you. Javed Sahab, you heard what Professor Dr. Ataur Rahman is saying. How, of course, in this kind of climate for the government to decide on taking exams, when of course this virus is also impacting children, is a decision that do you think will probably have to be re-evaluated at some stage, or do you think that, because of course, we are seeing like the situation of the oxygen, we are seeing the situation of the vaccine. Professor Saab very candidly said where we are in the order of things as far as our situation, economic situation is concerned. We don't have access to vaccine. Also,
I think the government and the society must take the human life as the most precious thing, and the exams come after that. So if the exams are postponed or the schools are closed for a while to protect the lives of the children of Pakistan, that's a very good decision. And the teachers and the parents must also cooperate with the Education Ministry, with the NCOC and other relevant authorities. Human life is more important.
Right.
And in a country like Pakistan, and specifically in a crisis situation, I think the entire nation should be prepared to face this natural disaster or this natural calamity. So we must be ready to face all kinds of situations, and I think we must be very patient also. In such situations, you have to make some sacrifices. You have to be disciplined. I think we must learn a lot from the Chinese, our neighbors. The virus originated there in Wuhan, and how Chinese have been able to control this virus, and almost they have eliminated it. And that they have done through discipline and through sacrifice, and I think we need to learn from the Chinese friends. So I think the nation, Pakistani nation, must also be very, very restrictive about it. They must go by the SOPs. They must follow them, and I think the sacrifice that Pakistan and the Pakistani society is going to make to fight this, to combat this virus, is ultimately going to decide the fate of our people and the society, and only in that way we will be able to get rid of it.
Right. Unfortunately, that's all the time that we have. Thank you so much for joining us, Javed Siddique Saab. Thank you for being with us. Professor Dr. Ataur Rahman, thank you for joining us today. Mufti Imran Sandhu, thank you for your very valuable input. As far as today is concerned, certainly we can start from today. If we haven't been following the SOPs, you can start from today. One cannot stress enough what the situation is outside. Everyone, each one of us can make a difference. Stay home, stay safe, follow the SOPs, do what you can in this kind of calamity, the pandemic that we are in the midst of. Let's hope that we can flatten the curve. Thank you so much for joining us today on Perspective.